Summer's here, and that means doctors at Nationwide Children's Hospital are preparing. They say summertime is when children are most at risk from injury from dogs. I'm Carla Rogner here with Dr. Dana Schwartz from Nationwide Children's Hospital. Thank you so much for being here. So how frequently are we seeing children come in the summer who are injured from dogs?
So summer is our most common time that we see these injuries, and that's because more dogs are outside and of course kids are out of school, so there's more chance for them to be interacting with the dogs. Year-round, we actually see at Nationwide Children's Hospital more than 400 dog bites per year. And that doesn't even include our primary care physicians and our urgent care physicians who are also treating those injuries, so that's probably an underestimate. So that means we're seeing more than one at times per day.
And in the summer, how does that really ramp up?
So in the summer, that is the most common time. If you were to look, that's when we see children affected the most, and it's kids often under the age of 9 that we're seeing come in from having, sustained this injury from a dog.
So we've been reporting on some pretty serious dog attacks, specifically on Avery, who's inspiring Avery's Law. So what kinds of trends are you seeing right now at Children's Hospital? Are they typically as serious as what we've seen happen with Avery, or what kind of is the range of trends that you're seeing?
So there's a wide range of things that we treat. Of course, thankfully, most of the common injuries are fairly minor. So we'll see kids who have a few puncture wounds, maybe a tear in the skin or a cut that requires some stitches, and they're typically treated sometimes with antibiotics or sewn up and sent home. But every year we do see quite a significant number of children who are admitted to the hospital as a result of their injuries. Some are who are taken directly from our emergency department to the operating room for surgeons with repairs of broken bones or cuts, sometimes even skin or soft tissue that's torn from the dog bites.
So I'm sure in addition to the physical trauma, when you see children who are injured from dog bites, there's also emotional trauma. Can you kind of talk about what you're seeing with that?
Absolutely. I mean, that's a very significant part of the patient experience with this, unfortunately. Often these injuries are sustained either in the patient's own home, it's the family dog, or in a trusted environment where it may be a neighbor or a friend's house. And so that has gone from a trusted situation to there where they've sustained an injury. So that's traumatic in and of itself. And then, of course, dogs are really common. So this is the type of animal that they're likely going to encounter again, like it or not. And so it's important to teach our patients resilience and to give them coping skills for that sort of situation. We actually have specifically trained trauma psychologists on staff who see all admitted patients who have a dog bite, working with not only the patient but also the family to work on strategies for that.
So what do you do if you're a parent and your child comes to you, they've been bitten by a dog? How do you know when it's time to go to the emergency room or seek some care from maybe urgent care?
So, if it's a fairly mild injury, meaning that there are puncture wounds or it's, somewhere that there's not a lot of bleeding and it's something you can easily look at with your eyes and assess, the first thing you want to do is just wash it out and then apply some pressure if there's some minor bleeding, and then call your child's doctor, because they will be able to give you advice on what the most appropriate venue would be. If there's ongoing bleeding, if it is a traumatic injury to the scalp, to the face, to the neck, that's something that you probably want to come to the emergency department for so that your child can be better assessed before things progress.
If maybe it's not serious enough to have to go to the doctor, is there a way you can kind of start to treat those minor dog bites at home?
So we'd recommend washing out the wound well with a lot of warm water, and then putting, either Band-Aids or something to cover the wound to keep it clean and dry, and then monitoring for signs of infection, because infection can develop in these wounds over the first few days, and so making sure that you're checking on that wound frequently for signs of kind of warmth or redness, more swelling. Those can all be signs that the wound's getting infected.
So children and adults who are bitten by dogs, does that automatically mean that they might need a rabies shot?
That's a great question, and that's something that the Public Health Department has advice on, and that we do that on a case-by-case basis. But the most important thing to remember is that if your child is bitten by a dog, it's important to identify the dog, try to get that dog's vaccination record so we know if the dog has been vaccinated, and also see if that dog can be kept in a space or a place where it can be observed for a period of time.
So of course it's probably better to be ahead of this and try to prevent this kind of thing from happening. Are there ways that parents can be proactive in trying to teach their children so that maybe this doesn't happen?
Absolutely. So a lot of families want to own a dog. So I think that's a very appropriate choice. You just have to do your research on the type of dog, the size of dog that might be most appropriate for your family, given if you have small children in the home. And then if you do choose a dog that may have some behavioral issues, making sure you get the appropriate training for that dog. Similarly, if your child is going to go to somebody else's house or to a neighbor, play date, what have you, asking, is there a dog in the home? And then teaching your child about appropriate behavior when interacting with a dog. How do we treat animals respectfully, not surprising animals, not going up to a mom who has puppies, that sort of thing. And actually, Nationwide has partnered with Columbus City Schools to offer a program called Safety City, where we educate on safety and prevention of all different things, crossing the street safely, fire safety, and dog bites or dog interactions is one of the things that we stress during that program as well.
So when you're seeing children come into the hospital for a dog bite, is it typically from a dog bite at home, or is it typically from maybe a dog that was at the park or something like that?
So the most contact you have is with your own family dog. So I would say that it is most often either the family dog or someone in the family who you're at a family member's house or has brought a dog into the home. It is often a known animal.
And what does it look like to the range of injuries that you see? I mean, how severe can this kind of situation be? What's the range of severity that you see?
The most common thing is cuts and puncture wounds, but on the more severe end of the spectrum, we do see children who have large flaps of tissue and skin that are taken off from the head, the face, neck, often up the arms. And internally, we can see children who have bleeding in the brain, their airway, their windpipe might be affected, or even if they're smaller internal organs that are bleeding from the pressure from the dog bite.
Are there situations that maybe parents should look out? Maybe their children aren't getting along with the dog, or are there red flags to look out for before a situation escalates?
Certainly if a dog is growling, snarling, approaching, or has a history of having behaved aggressively in the past, that's something to be aware of. We always do advise that children ask permission if it's not a dog that's known to them before going right up and either touching or approaching the animal.
And what kind of advice do you have for parents now as their kids are being sent outside to play more in the summer?
I think being aware if there are dogs around you, particularly if there are dogs that are not on a leash, and not approaching them if they're not known to you, and then being aware of those warning signs that are essentially a no thank you from that animal to approaching them.
Do you think that this is a bigger issue than some people might think, that this occurs more frequently?
I definitely think that it is. It shocked me when I started becoming interested in this trauma topic that we at Nationwide see over 400 a year. So that's really a common injury. It's one of the top 10 reasons that kids come in injured to the hospital. And so I think it's important to be aware of how common it can be and always kind of have it in the back of your mind if your kids are going to be around dogs.
And is there anything else I didn't ask you that you think is important that parents and families know about this topic?
I think it's just important to know if you do know someone who has been significantly affected by this type of injury. The thing about these injuries is they're often in very cosmetic areas, right? The face, the head, the exposed torso. And so there are children out there who are living and coping with these injuries, and just to be kind of sensitive of that and to teach children to be respectful.
I think this could probably also create some sort of a fear in children too, who've had even a minor experience with a dog as well. How should parents manage that? Even if maybe a child was chased by a dog or something like that, how can you kind of speak to your children to make them feel more comfortable around dogs again?
I think obviously dog bites are common in my world where we see them, but many, many dogs are out there who do not bite, who are very friendly. And so giving them exposure in kind of graduated ways with coping skills if they do get nervous to dogs that are going to behave in a friendly fashion and be more approachable so that they can kind of relearn that trust with the animal. And again, just keeping in mind warning signs if that animal or if an animal is sort of behaving aggressively.
Yeah. Well, all very important advice, and definitely good to be vigilant about this going into the summer. So thank you, Dr. Schwartz, for being here today.
Thank you
for more tips
me.
and tricks to keep your family safe, you can find this full interview at 10tv.com.